sporozoans. Number 23 na po tayo. Okay, so look at the image. Alam niyo po ito, no? Easy lang. Next. Here. Okay. Ito na po yung mga inclusions na present dito. Next. O ito, nakita nyo to, alam nyo na to. Okay. O ito, mas better. Okay. Dapat po alam to. This one is your, syempre, no? Plasmodium falciparum. Okay? So, this one is your Plasmodium falciparum causing malaria. And the one contributing to the highest fatality, no? For malaria cases due to your Plasmodium falciparum infection. Okay, so the vector basically for your malaria is the female Anopheles mosquito. Quick review lang po tayo. The final host is the mosquito. Tama? Kasi sa kanya nangyayari yung sexual stage or sporogony. Hence, the end stage is the formation of the sporozoites, the presence sa kanyang salivary gland. At yun po yung infective saman during a blood meal, yun po yung nakukuha natin kaya tayo nai-infect ng malaria. Okay, yung tayo naman po on the other hand serve as the intermediate host. Nasa atin naman po yung asexual stage or schizogony. So, ang end product naman sa atin is the formation of the schizont. Okay, the formation naman po of the schizont. Okay, sa ring stage, no? So nasa ating RBC stages or erythrocytic stages yung presence ng ring form or what we call the early trophozoite. Then we also have developing trophozoite, then we have schizont nga po, and then also the presence of the gametocytes. Okay? Again, Plasmodium falciparum nga po is the most fatal among all the Plasmodium species, and this one is associated with diseases such as black water fever, malignant tertian malaria, ayan, no? And then, what we usually see in the blood smear is the presence of the ring form and gametocytes. So ito yung mas nakikita natin yung ring form at saka gametocytes. Very rare na makita natin yung other stages unless nasa fatal stage na yung patient. So Plasmodium falciparum po may infect RBC at any stage. However, young infected cells do not enlarge, unlike po sa vivax at sa ovale nag-enlarge yung mga young infected cells, no? But for sa case ng falciparum, it can infect any RBC stage tapos walang enlargement na mangyayari sa cell. Okay? And Plasmodium falciparum also contains dark staining irregular camera-shaped dots which we call as Morer's dots. So meron siyang presence ng Morer's dots, 'di ba? For easier recall nga po, we have Ferdinand Marcos, so falciparum, Morer's dots, Vilma Santos, Plasmodium vivax, Schaffner's dots, orange juice, Plasmodium ovale, James dots, but ovale also contains Schaffner's dots. Okay? So wag mo confuse doon, no? Ovale also contains Schaffner's dots. And then aside from James dots, no? And then we have Malare, Manila Zoo contains Zeeman's dots. Okay? Again, that's for your Plasmodium falciparum. And also, what is unique for Plasmodium falciparum, nasa kanya nga po yung mga smallest na ring forms. Maliliit lang yung ring form sa kanya, pero multiple yung ring form. So, there is multiple parasitization of red cells in Plasmodium falciparum. Sa kanya lang po yun. No? Sa iba, paisa-isa lang ang ring form, pero sa kanya, multiple yung ring form. Okay? Tapos, Also, hindi lang siya simple na ring form lang. Sometimes we can see double nuclear dots as what you can see here, no? May double nuclear dots. No? Yung iba naman may marginal form, a plique form, or a cold form. And that is only seen in Plasmodium falciparum ring forms. Okay? Tapos, unique din po yung kanyang gametosite dito kasi yung crescent shape or banana shape gametosite is only seen in Plasmodium falciparum. The rest, round shape na siya or oval shape. Pero dito, it is crescent shape gametosite. Tapos we have macrogametosite and microgametosite. So this one is the female, this one is the male gametosite. No? And you can differentiate them based on their chromatin. Kasi ito po ay compact chromatin, ito naman dispersed chromatin naman for the microgametosite. Ito po yung infective stage na ngayon sa mosquito. So ito nakukuha ng mosquito sa ating blood, sa ating blood, no? So during blood meal, the mosquito will acquire the Plasmodium falciparum parasite, no? If makuha niya yung macro at saka micro gametocyte. And then nasa stage ano na yon, development na ng stage sa mosquito na, no? Hanggang sa mag-develop ng sporozoites, no, through the sporogony process, no? So again, that's your macro and the micro gametocyte. Again, most fatal nga po si falciparum, and the most prominent feature nga po is black water fever. Kaya po siya black water fever because of massive intravascular hemolysis resulting to black colored urine. Okay? And there's also a case of cerebral malaria, no? In Plasmodium falciparum. Okay, so going back here, so you can see a double nuclear dot present here na ring form ng Plasmodium falciparum. Again, possible lang po ang double nuclear dot sa Plasmodium falciparum. Ito naman, you can also see multiple ring forms na present dito, hindi lang isa, no? So may mga multiple ring form, meron ding mga double nuclear dots na present. Okay? Ito naman po ay yung gametocyte. So you can see here the gametocyte. No? Specifically, this one is a macrogametocyte. Yung crescent shape, banana shape nga po, applicable lang yan sa Plasmodium falciparum. So pag nakita mo yan, alam mo na kaagad na Plasmodium falciparum yan. No? So likewise, ganito rin, no? Gametocyte. No? So we also have your Plasmodium falciparum gametocyte. Again, that is for your Plasmodium falciparum. Clear po doon? Okay, next. Ito po yung image for number 24. Okay. Hindi ko na po isa-isahin, no, yung mga stages nila, no, pero I will ang kinuha ko po dito yung mga significant na content, no, significant na stage to differentiate nga yung mga Plasmodium species. So this one is your Plasmodium vivax trophozoite. So yung pinakita po kanina ay Plasmodium vivax trophozoite. Kasi yung trophozoite po ng Plasmodium vivax is described as amoeboid, no? So meron po siyang amoeboid trophozoite, Plasmodium vivax, no? So amoeboid trophozoite, Plasmodium vivax. So ang Plasmodium vivax po, again you can see here yung kanyang ring form nga po, pa-isa-isa lang yung kanyang ring form na present. And then we have the presence nga po ng amoeboid trophozoites. Vivax nga po contains Schaffner's dots, no? Makikita nyo rin po yun, no? Very distinct yung kanyang Schaffner's dots. Vivax nga po, similarly like ovale and vivax will invade nga po yung mga young RBC or your reticulocyte. And the RBC here will be enlarged, no? So lumalaki yung mga infected na red cell, no? Such as this one. Okay? And then, so yun, yung kanya pong gametocyte, round lang. Hindi naman siya crescent shape unlike sa falciparum. Again, that is for Plasmodium vivax. So again, the two most common cause nga po of malaria is attributed to Plasmodium vivax and Plasmodium falciparum. Okay? Next po tayo, number 25. Okay, here's the image. Okay, ito yun. Okay, this one is your Plasmodium ovale trophozoite. So, yun naman po ay Plasmodium ovale trophozoite. Hindi ko pa pala naalis ito. Pasensya na po. Ayan. Okay, so, that's for your Plasmodium ovale trophozoite nga po, wherein just like your vivax, ovale also infects young RBC or reticulocytes, wherein the RBC will be larger than normal. Present din po dito ang Schaffner stats in addition to James stats. So dalawa, no? Pwedeng James stats, pwedeng Schaffner stats po yung present dito. But for ovale, one characteristic nga, meron po siyang um, um, meron po siyang serrated saka fimbriated edges yung kanyang infected na RBC. No? So again, the RBC here will have a fimbriated or serrated edges. So serrated at saka fimbriated edges yung red blood cell dito. Okay, so again, that's for your Plasmodium ovalis. As you can see here, meron po siya ditong serrated saka fimbriated edges. Tapos mas enlarged nga yung red cell dito. So again, that's for your Plasmodium ovale. Okay? Okay? Pero again, syempre, prioritize first your Plasmodium falciparum, no? Kasi kung tatanungin man ito, most likely ang lalabas ay Plasmodium falciparum. Next. For number 26 na po tayo, no? 26. So, ano naman pong parasite ito? Okay. Next po. Okay, nakuha po ba? Again. And then, this one. Okay, so this one is your, syempre yung kulang na lang, no? Sino ba to? We have your Plasmodium malariae. No? So, Plasmodium malariae naman po, meron nga po siyang ring form din, no? Actually, pinakamalaki yung ring form pagdating kay Plasmodium malariae. Tapos meron po siyang presence ng band trophozoite. So that's somewhat unique to your Plasmodium malariae, no? Meron po siyang presence ng band trophozoite. Kasi kaya as you can see here sa first image kanina, no, this one is an example of a band trophozoite of Plasmodium malariae. Again, Plasmodium malariae band form trophozoite, no? So meron po siyang band trophozoite here. Tapos yung kanyang skyzone po, naka-encircle yung kanyang skyzone dito, arranged around a central pigment. Kaya mukha daw po siyang fruit pie, mukha daw po siyang rosette or daisy head merozoite. Okay, nakapaikot siya. So as you can see here, no? So ito naman po yung Plasmodium malariae skyzone nga po, wherein the skyzone, yung kanyang mga merozoites po, ito yung kanyang mga merozoites naka-arrange around a central pigment. Kaya mukha daw siyang fruit pie, rosette, or daisy head merozoite. Okay, so that is your Plasmodium malariae. Tama? Ayan. And then, you have here po yung mga difference nga for your vivax. Galitin natin para makita po niyo. Ayan, no? So, for your vivax malariae, ovale, and falciparum, so as you can see, yun po ating diniscuss din kanina. And then, for the characteristic nga po, we can, sa peripheral blood, we can see all stages sa vivax malariae for ovale. Pero for falciparum po, yung crescent shape po na kanyang gametocytes, saka yung mga ring forms po niya, yung nakikita na stages in the peripheral blood, no? The rest po, bibihirang makita yung mga skyzone niya, bihirang makita yon, no? Yung kanyang mga developing droplets unless fatal na po yung condition. Again, that's for your malaria, Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, and Plasmodium falciparum. Number 27 po tayo. Ito po yung image. Okay, so medyo i-focus ko po ng konti dun sa point ng arrow. Okay. Okay na po. Ayan. Balik ko po ulit. Oops. Okay, so this one is your, syempre, that's your Babesia microti, no? So Babesia microti po, so this one is transmitted through the bite of a tick, no? So yung isang po sa difference niya sa mga Plasmodium, ang Plasmodium po transmitted by female Anopheles mosquito, but for Babesia is transmitted by ticks, no? What you saw kanina sa image is actually the characteristic Maltese cross formation of the merozoites, no? So naka-arrange ng Maltese cross formation. Yung kanyang, sorry, not merozoites but ring form. No? So naka-arrange siya ng Maltese cross formation or tetrads in tetrads form. Okay? So there are also reports po that there is a simultaneous transmission of your Babesia microti and Borrelia burgdorferi, which is the one causing Lyme disease, no? Kasi po pareho sila ng vector because these two organisms are use the same tick vector, no? So Babesia microti sa Borrelia burgdorferi. Okay, so it can be confused po with Plasmodium falciparum, but with that Maltese cross formation, that is pathognomonic or very unique to your Babesia microti. No? Tapos, ano pang difference nila? Ang Babesia microti po, wala po siyang pigment, unlike kay falciparum na mayroon mga Schaffner's dots. Okay? Ayan. Next, number 28. Okay, so ito po siya. Ito medyo mahirap din ma-identify. No? Okay. Pero siguro if you will be given additional information, no, magiging helpful din naman, no? Pero tingin ko naman, very rare naman na ma-encounter natin tong mga ganito pang specimen. Okay? Or even in an examination, no? Bibihira naman, no? But for the purpose of this Atlas lecture nga po, para madaanan natin. Okay? So this one is your Toxoplasma gondii. No? So, the Toxoplasma gondii po, cat po yung definitive host, tama, for Toxoplasma gondii. So, we acquire the infection kapag nakuha natin yung mga trophozoite, and the trophozoite here can be in two form. We have your bradyzoite and tachyzoites. So, tachyzoites po dito yung actively dividing form. And the most at risk here are pregnant patients because the tachyzoites can cross the blood-brain barrier, and it can result nga po to fetal death as well as kung hindi man fetal death, it can also result to mental retardation in newborn or blindness in later life. So part po ito ng congenital transmission, di ba? Yung torches, toxoplasma, rubella, cytomegalovirus, and herpes. So toxoplasma po can cause nga po congenital transmission resulting nga po to fetal death as well as mental retardation in newborn or blindness in later life. Okay, so again, that's for your Toxoplasma gondii. This one is a Toxoplasma gondii tachyzoites. Okay, pointed by the arrow here. Okay, next, number 29. Okay, ito po yung image. Okay, next po. And then, so this one, ang stain po nito ay modified acid-fast stain. O alam nyo na, no? Sinabi kong modified acid-fast stain. Ito din, modified acid-fast stain. And ito naman, phase contrast microscopy lang po ito. Okay? Again, ulitin ko po. Ito. This one. And then, this one. Okay na po? Okay. Tingnan natin kung tama po yung sagot natin. This one is your Cryptosporidium. Yes. No? So this one is your Cryptosporidium oocyst. It is also associated nga po with intestinal infection, diarrhea. Pero ito po ay common sa mga immunocompromised patient such as AIDS patient. Okay? And one of the tests nga po for the identification of your coccidians. No, hindi lang po Cryptosporidium, but it applies to all coccidians such as Isospora, Cyclospora. No? So we can perform modified acid-fast staining wherein it will show nga po a purple to red color. Purple to red to pink color. Kaya nga dito, no, we are using a modified acid-fast stain. Dito medyo purple color na to. Ito naman medyo pinkish red color. No? So purple to pink to red color yung positive result for the oocyst of your coccidian. And this one shows nga po Cryptosporidium oocyst, Cryptosporidium oocyst. Ito naman, Cryptosporidium oocyst under phase contrast microscopy. Okay? So we have your Cryptosporidium oocyst. For concentration test naman po, we can perform sugar flotation. So yun po yung common, no? Schitter's sugar flotation for your coccidians. No? So, it applies to the oocyst of all coccidian, Cryptosporidium, Isospora, Cyclospora. We can perform Scheiter sugar flotation. We can perform your modified acid-fast staining. But for identification purpose, this one is your Cryptosporidium oocyst. Okay, next po tayo. So, tinan nyo po dito yung may dalawang presence dito ng sporocyst. So, these are two sporocysts. Okay? Likewise, ito rin po yung next image. So, again, we can see here two sporocysts. Okay? Nakuha na po. Ito, and then ito. Okay? So, this one is your Isospora belli oocyst. No? So, for Isospora, what is unique here is the presence nga po of two mature sporocysts. No? As you can see here, mentioned two sporocysts dito, two sporocysts din po dito for Isospora. No? And ito po walang stain na ginamit dito. No? Pero for staining, we can also perform modified acid-fast staining, and for concentration technique, we can perform nga rin po yung Scheiter sugar flotation. Again, part din po ito ng coccidians. No? So, we have your Isospora. Next, number 30. Okay, baka hindi pa tayo ganun ka-familiar dito. This one is your, again, para lang din po ma-mention natin, no? This one is your Pneumocystis jirovecii, formerly called Pneumocystis carini. So before, it was classified under your protozoas, under parasitology, but now it is considered as a fungus. Okay? This one is causing nga po lung infection, particularly among immunocompromised patients. Like for example, those suffering from AIDS, no? Or malignancies, yan, pwedeng matarget nga ng Pneumocystis jirovecii. For successful diagnosis of Pneumocystis jirovecii, aside from your staining, like mga normal na stain, we are performing histologic procedures such as Gomoris methanamine silver stain. So yun po yung mga ideal na histologic procedure for Pneumocystis jirovecii. Previously known as Pneumocystis carini, again causing nga po lung infection or respiratory infection among immunosuppressed or immunocompromised patient, particularly those suffering from AIDS, okay, and other malignancies. Okay, so that ends po yung ating protozoans, from your amoeba to your flagellates. You also have your hemoflagellates there, Leishmanian trypanosoma. And then we've also discussed yung mga sporozoans, no? Ciliata muna, and then your sporozoans from Plasmodium to Babesia to your coccidians, no? Cryptosporidium, Isospora, Toxoplasma, and then we've also added, no, yung Pneumocystis, no? And we've also mentioned din kanina yung Blastocystis hominis. Okay, so let's now move to your metazoans.